Recognizing early warning signs of Alzheimer's disease. A critical guide. Alzheimer's disease is one of the most challenging health conditions, especially for older adults. As a progressive neurological disorder, Alzheimer's impacts memory, thinking, and behavior, eventually affecting a person's ability to carry out daily activities. In this article, we'll delve into the earliest signs of Alzheimer's that caregivers and family members should be aware of, offering a fresh perspective on the symptoms, their impact, and how to approach potential concerns. Introduction: the importance of early detection. As we age, certain cognitive changes are expected: slower recall, occasional forgetfulness, and difficulty concentrating. However, when these lapses escalate, they might indicate something more severe, such as Alzheimer's disease or another form of dementia. Early recognition of these signs is crucial because the sooner intervention occurs, the better the outcomes for managing symptoms and providing care. Alzheimer's doesn't have a definitive cure yet, but treatments and lifestyle adjustments can help slow its progression. Let's explore the signs you should keep an eye on. 1. Short-term memory loss. More than forgetfulness. One of the most common misconceptions is that memory loss is simply a part of aging. While it's normal to forget a name or a word now and then, persistent short-term memory problems are a red flag. In the early stages of Alzheimer's, people may frequently forget recent conversations or misplace everyday items. They might repeat questions or forget what they were just told. Scientific studies show that while Alzheimer's primarily affects short-term memory, long-term memory can remain intact much longer, leading to disorienting situations where an individual remembers their childhood but forgets what happened earlier in the day. Second, repetition of stories and questions. If a loved one starts repeating the same stories or asking the same questions without realizing it, this could be a sign of cognitive decline. Often, individuals with Alzheimer's do not remember they've already told a story or asked a question. This repetition can occur not only in conversations, but also in familiar situations. A real-life example comes from a hospital setting, where an elderly man repeatedly spoke about his desire to eat beans and greens, a harmless repetition, but it eventually revealed underlying memory issues. 3. Difficulty with everyday tasks. In the early stages of Alzheimer's, individuals may struggle with complex tasks they previously managed with ease. Activities such as cooking, paying bills, or scheduling appointments may become overwhelming. This is because Alzheimer's affects executive functions, abilities needed to plan, organize, and solve problems. For example, cooking a meal may involve several steps like managing the stove, chopping ingredients, and timing everything correctly, which becomes increasingly difficult as brain function deteriorates. Denial and lack of insight. A significant and often frustrating aspect of Alzheimer's is anosognosia, a lack of awareness or insight into one's cognitive decline. Individuals might deny they're having trouble remembering things, often refusing to acknowledge the changes occurring in their daily lives. This denial isn't intentional, but is a result of how Alzheimer's affects the brain. In some cases, the person might not even notice their memory lapses, or they may be afraid of losing their independence, causing them to ignore the issue altogether. 5. Accusations of theft or misplacement. Another worrying sign is when an individual begins accusing others of stealing things, misplacing their wallet, glasses, or personal items. At first, this may seem like harmless forgetfulness, but over time, it can evolve into paranoia. In reality, the individual may have forgotten where they placed the items but, unable to accept the memory loss, project the blame onto others. This behavior is common in Alzheimer's and can be emotionally challenging for caregivers, as it introduces an element of suspicion into the relationship. 6. Delusions and false beliefs. In the earlier stages, some individuals may start to exhibit delusions, where they believe things that are not based in reality. This can include bizarre thoughts, like believing someone is poisoning their food or that their spouse is unfaithful. Delusions often occur alongside other cognitive impairments, but in some cases, they can be one of the first signs of Alzheimer's. It's essential to understand that these false beliefs aren't the result of malice or intentional deception, but are caused by changes in the brain due to the disease. 7. Hallucinations. Hallucinations are another sign that may appear in some individuals. A hallucination occurs when a person perceives something that isn't present, such as hearing voices or seeing people or objects that aren't there. While visual hallucinations are often associated with other forms of dementia, such as Lewy body dementia, they can also appear in Alzheimer's patients as the disease progresses. 8. Getting lost in familiar places. As Alzheimer's affects spatial memory, individuals may become disoriented and lost in places they've visited frequently. They might wander off in familiar neighborhoods or forget how to get home from a regular destination. This symptom is particularly concerning because it can lead to dangerous situations, where the individual might end up in unfamiliar places without knowing how to return. Struggles with language and communication. Language difficulties are common in Alzheimer's, especially when it comes to finding the right words or naming objects. An individual might struggle to recall simple words, resorting to vague descriptors like thing or that thing you sit on instead of chair. This type of aphasia, a language disorder, can significantly impair communication and increase frustration for both the person and their caregivers. 10. Uncharacteristic changes in behavior. Finally, any significant and uncharacteristic changes in behavior or personality should be treated with caution. For instance, a once socially active person might become withdrawn, or an individual with a calm disposition might exhibit reckless behaviors. These changes often stem from a decline in judgment and decision-making abilities. Caregivers may notice that their loved one's actions no longer align with their previous values or personality traits, which can be distressing for everyone involved. Conclusion: taking action early. If you notice one or more of these warning signs in a loved one, it's crucial not to panic, but to pay attention and seek professional evaluation. While Alzheimer's disease is a serious condition, early detection and diagnosis are key to managing the symptoms effectively. There is no cure yet, but treatments and lifestyle changes can help improve quality of life and slow down cognitive decline. If you're worried about an aging parent or family member, getting a medical evaluation can provide clarity and help you take the right steps towards supporting their health. By recognizing these signs early, you empower yourself and your family to provide the necessary care and intervention. The next step is working with healthcare professionals to develop a personalized plan for managing Alzheimer's symptoms and ensuring that your loved one remains as comfortable and independent as possible for as long as possible.